Thank you to Dr. Anupindi and Dr. Yadav for that presentation and for your comments. We'll now move into that Q&A session. And just a reminder for our audience, if you would like to submit a question, you could just simply type that into the chat box below your video frame. And we're also joined by several other committee members for this Q&A period. We also have with us today Dr. Matthew Downham, who is with the Coalition for Epidemic Preparedness Innovations in the UK as a Sustainable Manufacturing Lead. We have Dr. Noreen Hynes, who's a physician trained and board certified in internal medicine and infectious diseases with additional tropical medicine and epidemiology training. She also serves on the faculty at the Johns Hopkins University Schools of Medicine and Public Health. And finally, we have Dr. Jennifer Pancorbo, who is Director of Industry Programs and Research at the Biomanufacturing Training and Education Center. So our first question for our panel is, how did the committee decide that the G20 would house the proposed manufacturing task force, and what would this entity look like?
Prashant, you want to take that? Prashant, do you want to respond to that?
I'm happy, Ravi, but I think Matthew might be good to talk about this as well. If not, I'm happy to talk about it.
That's fine. Thank you. Thank you very much, Prashant, and I hope you can hear me all okay. So indeed, the suggestion was that the COVAX Manufacturing Task Force, that's been in existence now for about 4 months, be housed under the G20, particularly given some of the activities that the COVAX Manufacturing Task Force is engaging on, particularly thinking through to one of the particular work streams co-convened by the WHO to support vaccine manufacturing capacity capability across low middle income countries. And this was felt to be aligned not just with the G20, but also with the G20's initiative in terms of supporting, for example, geodiversification of vaccine manufacturing moving forwards, particularly to ensure improved public health security provision for those particularly in maybe underserved or regions of the world that don't necessarily have vaccine supply currently. So the sense was the alignment, particularly, like I say, between the COVAX Manufacturing Task Force's remit, objectives, its vision, its mission, and how that aligned with the G20 accordingly. So that addresses the question appropriately. Thank you.
One thing I will add to what Matthew said was, I think the committee deliberated quite a bit on the idea of what's the right hosting entity and structure for this task force. And the two ideas that we took into account in our deliberations were, it has to be hosted in a place where the membership is consisting of countries which are currently or likely to be vaccine manufacturing countries. And we also took into account that, if it is hosted by a structure which is all member states, then we may not have the kind of governance that is needed for something which is very specific, a technical task that requires very intense coordination. So I think those 2 points led the committee to think about the G20 as the structure for hosting.
Thank you. Our next question for you all is, recommendation 4.3 discusses commissioning studies on demand forecasting and uptake. We know that demand varies, so is there more context on feasibility and how this can be improved?
Yeah, I can offer something and then maybe have other people jump in. I think yes, demand is uncertain, but also influenced by local issues in terms of demand uptake, etc. So therefore, getting a good sense of what are the factors that are impacting demand, whether it is hesitancy issues, prior experience with health systems, there are many factors that go into that. So and that could also be, those factors could be country and region specific. So therefore, we are calling for research to kind of capture some of those that will impact how demand forecasting can be done. And that then filters up and aggregated such that a vaccine manufacturing network could figure out how much capacity to invest in, et cetera. Anybody else wants to add something? Yeah.
One thing I will add to what Ravi said, and then, sorry, Jennifer, is the idea that we have to make a start with better forecasting for seasonal flu vaccine. That will get us closer to having better forecasts for pandemic influenza. Because we are talking about influenza vaccines, I think the start has to be, we can do much better on seasonal vaccine, seasonal flu vaccine or seasonal influenza vaccine forecasting, and then from there, build and contribute to the capabilities for pandemic. But Jennifer and others have probably comments too.
Hi, thank you, Prashant. If I may add, one of the other rationales that we entertained was the idea that we need to somewhat incentivize organizations and countries to look into taking manufacturing, production, and tracking of components that are important for vaccine manufacturing, influenza in particular, but others in general. And by looking into the demand and the needs that different regions may have, then we can open up potential solutions and open up incentives for organizations to engage in manufacturing. And by expanding the manufacturing capability, then we go into solving some of the other issues as well.
Yeah, Noreen?
One of the things that certainly has been discussed in other groups and was discussed by ours has to do with in an LMIC, influenza might not be traditionally seen as an important problem when there are limited resources that you need to spend other things on. However, in the setting of the current pandemic, which is of course a respiratory virus, it will be very interesting to see what impact or change in demand this has as people wish to prevent other potentially serious respiratory diseases. And if we can marry up with that, we might be able to get some better sense of the inputs that go into demand in different countries and in different settings, and that the uptake might be improved.
Thank you, Noreen. Matthew, anything you want to add to that?
No, I think it's all very nicely been said. Appreciate the opportunity. Thank you.
Thanks.
Regarding recommendation 6.5 on agreeing to inspection and only exporting emergency use listing or pre-qualified vaccines, how did you decide to recommend a treaty as opposed to other mechanisms to do this?
Who wants to take that up, Prashant or Noreen?
Thanks. I will take a stab at based upon our discussions, but the important thing is that a treaty has a much different impact than a recommendation would have from WHO. And in light of the fact that we have seen during the current pandemic, the release of vaccines, perhaps before their time, that is, before there was sufficient data to understand what was the efficacy of a vaccine, which could have dissuaded population uptake. So we were thinking that something that was codified in a way that countries agree to, and there could be, the carrot and stick associated with this, we might have a more adherent group to following the necessary guidances for releasing a vaccine that essentially can be accepted globally under an emergency use listing.
So to add to what Noreen said, I think we had quite intense discussions in the committee about how do we ensure that quality standards are stringent and they're upheld. And we talked about a combination of incentives and disincentives. Disincentives to make sure that there is some way to discourage manufacturers from bypassing good practices, adherence to good manufacturing practices. And one of the ideas was that you could do that by the Global Indemnity Program, which is the only manufacturers who would be allowed to be a part of the Global Indemnity Program would be the ones who go through a proper WHO pre-qualification or emergency use listing. But then we said there are still going to be requirements for the need to conduct independent audits and quality inspections, and housing all of this under an existing treaty or the treaty that is being discussed gives it the farthest reach and creates the right balance of incentives and disincentives for quality audits. And that was, in a way, the driving factor in putting 6.5b under a treaty-like recommendation.
Thank you all. Our next question is, the findings and recommendations from this study seem applicable to the supply chain for PPE in general, for example, high filtration masks, medical gloves, and rapid result diagnostic tests. This has been a roller coaster of supply and demand, and lack of high quality PPE was a key factor in community spread of SARS-CoV-2 at the beginning of the pandemic. What are the committee's thoughts on this?
I can take a shot. I mean, we didn't discuss, obviously, this was not part of our SOT to discuss other public health countermeasures. But you're right. I think, the question that the structures are, similar structures would be definitely relevant for, whether it's PPE or ventilators or other kinds of things, because we have seen similar chaos happen in scaling up of the manufacturing of those. So this comes under the broader idea about, this is where the recommendation 3.1, which is, and then what Prashant was talking about in his comments, saying good data systems thinking and a coordinated risk management structure. I mean, that's in some ways a universal kind of thing. If you want to think about resiliency of supply chain for any critical good. But we didn't in our committee focus on the other. But yeah, I would say that, those structures I think are relevant for much more broadly. Anybody else wants to add to that? Matthew?
Yes, I mean, certainly I think the PPE is an illustration of how the pandemic has hit, the COVID pandemic has impacted multiple supply chains and supply aspects that have impacted not just healthcare, health measure control provisions, but also the vaccine industries. And so there's a certain thought behind how supply chains need to be managed, particularly in future from a surge demand perspective. So there's that aspect as well. And certainly I think, the issue regarding the PPE illustrates the pressures put on systems when pandemics emerge and how they may impact other vaccine products like influenza, etc., that are used on an annual basis. It's a good question. Thank you.
Jennifer and then Prashant. Yeah.
Thank you, Ravi. And if I may add to what Matthew just mentioned, we actually did discuss extensively PPE in the context of manufacturing, because a lot of the same components that are utilized in care and in health are shared by manufacturing facilities and the gowning that are required to access clean rooms and manufacturing facilities. So this objective is definitely all-encompassing, and like Matthew indicated, PPE is an example of the many components that we try to address.
Yeah, I was going to say two things. One is along the lines of what Jennifer said, which is the manufacturing network that we are talking about, which is going to get expanded, will have new sites. We did talk about the need to have safety in place for workers in those manufacturing plants. So that is dependent on having PPE. The second is that I would like to conjecture that the supply chain for PPE in that sense is somewhat simpler than what we face for flu vaccines, partly because the strain and the strain matching and those things have to be done each year, whereas for PPE, it's in that sense a somewhat more standardized product. So the planning processes are a little bit more complex and depend upon information getting revealed much closer to the season. And I think, therefore, we think this is more complex than the supply chain for PPE or other medical products that were brought up.
Right. Yeah. Thank you, Prashant.
Thank you. Our next question is two parts. So how can we ensure that low and middle income countries don't get left behind in the rollout of a potential pandemic influenza vaccine? And then how can LMICs be more engaged in the manufacturing?
Let's take that. Matthew? Yeah.
Thank you. Yes, I mean, obviously from CEPI, we're closely involved with the COVAX facility that is, of course, trying to support ensuring that low middle income countries are not left behind in terms of the COVID pandemic currently. It's that drive to ensure equitable access to vaccines across the COVAX facility, which of course is CEPI, Gavi, UNICEF and WHO. And such a mechanism, I think, has really illustrated how groups have to pull together to facilitate getting vaccines to support LMICs, but also the complexity of distributing vaccines into low middle income countries. And so in terms of the question, in terms of also how can LMICs be more involved and not left behind, I think there's a call here to have more geo-diversification of vaccine manufacturing. In other words, establish footprint in low middle income countries, low middle income regions, such that vaccine distribution can be more accessible, more rapidly in an agile sense, and provided from directly within specific regions rather than having core centres globally where vaccines are currently and arguably distributed from. So there's a whole piece of work around how to ensure lessons learned, let's say, from the current COVID pandemic, that LMICs are better served, better provided for, and some of that speaks to, like I say, geodiversification, improving vaccine manufacturing capacity capability in them maybe where it exists today and needs to be expanded, or countries where it doesn't exist and needs to be established from the ground up. And that's some of the motivation, like I say, behind CEPI and of course COVAX over. And I can see Noreen is indicating to speak, so I'll stop. Thank you.
Thanks, Matt. And we also discussed the whole issue, remembering the very nice diagram or pictorial that Ravi showed. There are so many component parts that go into a vaccine, over 100 things that are needed. And we did also discuss the importance of regionalization, but also it could be an ultimate goal for a country, a low or low middle income country, to become a vaccine manufacturer. But it can also begin with becoming a manufacturer of critical component parts that become part of this, and that within a regional hub, they feed into it with a one or more regional manufacturers in an area. So it isn't a solution overnight. It's building capacity in a progressive manner.
Prashant and then Jennifer. Yeah.
So I think we had multiple discussions. I think the precise recommendations in the committee's report that touch on this issue, as far as I recollect, are two. One is what focuses on asking this new task force to explicitly look at the value of decentralized manufacturing, to what extent can it be put in place, evaluating the economics and technical aspects of more decentralized manufacturing. So I think the committee isn't recommending a full-fledged to go do decentralized manufacturing. It is saying that this task force needs to get into that more deeper. The second is that where the committee is making a specific recommendation is around the area of workforce development for vaccine manufacturing. And that's an area where I think there is an explicit ask that Health and Human Services and other agencies should look at how can we develop a stronger workforce for vaccine manufacturing, which can then contribute to more localized manufacturing emerging over time.
Jennifer?
Yes, if I may add, as following on Noreen's idea that this is something that will be developed over time, kind of ties back to one of the first questions we had about demand and understanding demand. So using that knowledge will help us build up that understanding and then evolve the situation in terms of low and mid-income countries. We learned through our investigations that depending in the region, some regions are very open and really engaged in influenza vaccination, and others are not so much for a number of reasons. And so understanding that demand and how that pulls will eventually help us develop a more strength in the hub and more interaction between the manufacturers and the various organizations involved.
Noreen?
And also building on what Jennifer has said, and Matt and Prashant and Ravi, has to do with another thing that we spoke about, and certainly would be under the umbrella of a G20 task force that's created, is providing other incentives that would assist new actors in the field of vaccine development across the spectrum of the needed supplies. And that would be particularly when you get to manufacturing, because of the difficulty going from small scale to large scale. Part of one of our recommendations was that for these newer developers and small biotechs, that as part of a contract, at least within the United States, and this could be something that the task force could examine, or even under treaty, that you would need to identify a successful manufacturer to partner with to help you get across the finish line. And of course, would in fact be a step in building further capacity.
One last thing I would add, Stephanie, is that I think in the governance structures, we call for it to be an inclusive governance structure. So, for example, the developing country vaccine manufacturing network should have representation there. So I think the other way to get the voices heard, both from a manufacturer's perspective as well as country perspectives, is to have more inclusive governance structures. Thank you.
Thank you. Next question is about recommendation 5, specifically the mechanism to evaluate preparedness plans. How did you envision this compared to other efforts like the U.S. General Service Administration's plan? And how would these work together, or are they completely separate from each other?
Yeah. We didn't get into details about how we would evaluate preparedness, but the idea that a lot of discussion in our group was that the preparedness plans are not granular enough. Countries are not obligated to submit their preparedness plans to the quality needed. So we need to develop, both give technical support as well as, structure incentives to ensure that the preparedness plans are robust enough. So that was kind of the idea. And the second one was that it's dynamic. So that is why the recommendation 5.1 is talking about a periodical convening and updating based on lessons learned. What we had a preparedness plan before, is that still relevant? Are there gaps? So how do we know? So we didn't get into details about how actually to measure preparedness, but the idea of doing mock drills, etc., tabletop exercises are one way to ensure that a country is prepared. Anybody else wants to add to that? No? Noreen?
We did discuss the fact that there is, at least under the global health security agenda, the joint external evaluation process that does look at preparedness planning. However, it is unusual for any of those plans to go so far as to look at their manufacturing or elements of manufacturing capacity. It really has to do with a traditional Ministry of Health preparedness plan, being ready to respond, do additional surveillance, which we heard earlier today is very, very critically important. But it has not gotten into the manufacturing and supply capacity in many of those plans, and not all countries participate. So it's an idea that can be embellished as, for example, when the G20 task force could look at this further.
So I suppose, you raised the issue about questioner raises the issue about the existing kind of frameworks. I think part of this convening also is to begin to understand that, okay, where are the gaps? Are existing frameworks good enough? What has been your experience from, countries' experiences from managing the COVID-19? If there are gaps, that is why the periodical convening to upgrade them or maybe develop new sets of criteria for what preparedness actually means.
Thank you. And since we are nearing the end of the time, it looks like this may be our last question, and we'd love to hear from all of you. Looking again at recommendation number 5 on real-time global data to inform manufacturing, the World Health Organization is working on efforts to develop large-scale global data dashboard or hub that takes in information from companies to inform broad supply chain efforts. Is this similar to what this committee was envisioning for influenza vaccines?
Matthew, you want to take that?
In simple terms, yes. So the WHO hub is largely leveraging off the WHO's influenza program in terms of rapidly sharing data, for example, through GISAID, the database GISAID, leveraging off the GISRAS infrastructure, the WHO's flu network of laboratories globally that are monitoring and tracking the disease and its epidemiological development, all of which feeds into the manufacturing strategies and decision-making process. So certainly, that exists today and has been in existence close to 70 years, certainly was the kind of template. And certainly, as I say, the WHO is thinking forward to using that kind of model for future activities to monitor and track diseases and inform manufacturing accordingly. So, as I say, the simple answer is yes, but obviously open to my colleagues for further feedback.
So again, I wasn't sure, WHO the World Health Organization has 2 or 3 initiatives which are probably fitting to what was described in the question. If it is about the influenza GISAID work that Matthew's describing, I fully agree, but it could also very well be about the WHO's work on building a control tower, a demand and supply matching tool for essential COVID technologies. And if that's the one that is being referred to in this question, I think it is structurally like that. But I think what we're recommending goes one level farther, and it says a planning methodology which brings together what is the current supply, what is the currently installed manufacturing capacity, and what is the demand, and what tool allows doing that planning for influenza vaccines, both seasonal and for scenarios of pandemic.
Thank you. Anybody else? Mr. Brad? I think I'd just like to add to that, Stephanie. I think also what we discussed in our committee is bottom up. There's lots of the country-specific situation varies and is dynamic as it's changing. Are there mechanisms or tools to be developed that can capture some of that? And of course, there'll be data sharing restrictions that countries may have, but whatever level is needed for global planning, is there a mechanism or platform to filter some of that out such that from a global supply perspective, one is getting a better picture of what that time phase demand might look like? Anybody else? No, I think that's all we have. Yeah.
Well, thank you so much to you, Dr. Anupindi, and to Dr. Yadav, and for all of the fellow committee members. And to our audience, some of you have spent the better part of today with us for these presentations, so thank you for that. And just a reminder, once you exit this webinar, you'll be redirected to the main study page, and from there you can download all 4 reports and the related material. So again, thank you. Have a great rest of your day.
Thank you, Stephanie. And thank you, everybody, for listening in. And thank you, committee members. Appreciate that. Yeah.